The second Monday of February every year is being celebrated as the Epilepsy Awareness Day. So this time it coincides with the February 14th, the Valentine's Day as well. Epilepsy, a lot of people think it is something because of the possession of something and some unusual problem in the brain. In fact, epilepsy is like any other medical condition like diabetes, hypothyroidism, blood pressure or any other illness is another disease. So this disease affects the brain. Normally, brain has an electrical activity through which it controls all the activities of the body. Whenever there is a spark in the electrical activity due to various reasons inside the brain, it can cause something like a shock or like a big burst inside the surge of electrical activity inside the brain, shutting down temporarily the entire activity. That is the time people will fall down and might become unconscious for a brief period of time. Now, epilepsy, unlike others believe, is a medical condition that is diagnosable and treatable adequately. And if it is diagnosed early and treated adequately and appropriately, it can be controlled completely, and many of the people will get a cure after a certain period of time. Now, epilepsy can be of many types, so that sometimes they miss out. Normally, everyone is aware of a person rolling up the eyeballs, putting out the tongue, making a cry, and froth coming out of the mouth, and having movements, violent movements of the hands and legs which are uncontrolled, which last for a few seconds. And after that, they might pass urine or motion in the bed itself, and they remain unresponsive for about few seconds and gradually recover within half an hour's time. And this is called a generalized tonic-clonic seizures, where the patient becomes completely unconscious. Now, there are many attacks where they need not fall down at all. Something like a drop attacks, where suddenly, without any notice, they'll fall down, remain unconscious for a few seconds, and they get up. So this is another type of epilepsy. Now, there is another epilepsy called absence attacks. A person will be talking continuously and suddenly loses touch with the surroundings, goes blank for a few seconds, and quickly continues from wherever they have stopped, and either the conversation or the work whichever they were doing before. And these can become repetitive and multiple attacks. It's called absence seizures. So these are all generalized seizures. Some of them can be just focal seizures, where an abnormal sensation can come into the hand repeatedly, last for a while and go away. Similarly, an abnormal movements like shaking of the hands is called focal sensory seizures or focal motor seizures. There is another variety of seizures called complex partial seizures, where they don't lose consciousness, but they have suddenly loss of touch with surroundings. They may have abnormal bizarre movements, but they have a lot of smacking movements of the lips and behavioral disturbance, picking movements, everything which lasts for a few seconds, and then they become totally normal. So these are the many varieties of epilepsies that depends upon the type of electrical abnormality and the type of area of the brain where the abnormality starts. So any of these symptoms can suggest that there could be an epileptic disorder, and once they come to the hospital, we can certainly look into the details and then make a diagnosis.